So we're going to do the postpartum assessment. So first you would start with co-wipe. You would check your orders, check your allergies, assemble your supplies, wash your hands, introduce yourself, identify your patient, provide for privacy, explain, educate, and evaluate. So first you would go ahead and get a set of vital signs. So we'll go ahead and do that. We'll go ahead, listen to the heart. Okay, after you've done that, go ahead and listen to it for a full minute, and then we'll go ahead and listen to the lung sounds. I get you to try to raise up. Okay, so after we listen to the lung sounds, then we will go ahead and then next we listen to the bowel sounds. Okay, and then to declare them actually absent, you would go ahead and have to listen to them for a full 5 minutes. Alright, so first we're going to start with the actual uterus, and we're going to check to see if the fundus would be boggy or if it would be firm. So you would find your umbilicus, and then a finger whip down would be about 1 day postpartum. So we'll go ahead and we'll go 2. Now say that it was actually soft. You would go ahead and you would put this hand down here, then you would go ahead and massage just ever so gently in this area, making sure to support it underneath. And that's to help prevent the bleeding that's associated with a boggy uterus. And before you did that, you would want to go ahead and palpate the bladder to see if there was any, if they had a full bladder. That too in itself could cause the actual fundus to be kind of displaced if it's not exactly midline like it's supposed to be. Alright, so then once you've done that, we'll go ahead, we'll do the assessment of the breast. You would just kind of palpate. You would ask them, is there any tenderness? Obviously you could tell if they was engorged. Are you planning on breastfeeding? If they said yes, then you would go ahead, you would teach them the correct way to actually breastfeed with the baby. If they're not breastfeeding, then you want to let them know that ways to cut down on their actual milk. You can go ahead and wear like a tight fitting bra. You can use ice packs. You definitely would not want to apply heat. And then if you do express milk by hand, you would only want to express just enough to relieve the pressure. You would also want to check the nipples. At this time, go ahead, see if there's any drainage, discoloration, anything at all like that going on. Alright, so then we're going to go ahead and we're going to go to the bladder. So with the bladder, like I said, you would want to make sure that it's not distended. If they do have a catheter, you would want to make sure that the catheter is removed within a timely manner. Typically, you don't want to leave a catheter in more than 24 hours because if you do, then it would increase your risk of infections. But definitely follow your doctor's order. Okay. So the next what you would do is go ahead and then check their legs. That would be your Holman sign. And you would go ahead and just make sure that pretty much that they don't have any blood clots. Is there any tenderness or anything in your legs?
No.
Okay. And the easiest way to help prevent a blood clot would be to go ahead and do ambulation as quickly as possible once they've actually delivered the baby. And then also too, you would want to push fluids. And then when you're assessing the bowels, you would want to go ahead and ask them if they're constipated. Have you had any constipation?
No.
Okay, so then you would go ahead, and if they said that they had, which it's typically common that stool softeners are actually already like a standing order, and that is because of the need for hemorrhoid relief. Typically pregnant women who've just given birth typically have hemorrhoids. All right, so for this next part, I'm gonna have you turn on your side and kind of put your leg up a little bit. So for this part, you would look for the episiotomy site. So you would look right here in the middle. You would want to make sure that there was no swelling, no redness, no drainage, anything like that. If you did have any of that going on, then that's typically a sign of infection. To help to decrease their pain, you could also use the peri spray that they give you in the hospital. And then you could also apply ice packs as well. Again, you would not want to use heat because heat is a dilator. Okay, so for the next part, you would just want to ask them how their mood is overall. You can go ahead and turn back on your back. So you would want to ask them how their mood has been, and just observe it too when you go in the room. You want to make sure that they're bonding with the baby appropriately. Make sure that they're actually feeling okay. Typically, a newborn mother, you'll definitely want to give lots of reassurance and education. And even with adolescents, it's not our place to judge. Okay, so for the next part, we're going to actually go ahead and make sure that they're holding the baby. You would want to make sure that the contact that they typically, at this point, they're doing the in-face position, which is also, it's kind of just where they hold the baby up to them. They're just kind of, they're bonding with them, actually. And you want to make sure that if the father is active in this part of everything, you want to make sure that the father's actually included and on that as well, as far as the education. And you want to make sure that you talk to the patient versus talking to their family member or to their significant other. Okay. For the next part, you would assess their energy level, which part of their energy level would be dietary. You would make sure that they've been receiving adequate amount of food. Make sure that if they are breastfeeding, that that's going okay. Make sure that they're not having any complications as far as being able to keep anything down on their stomach. And then you would also too want to know how well they're resting. You would want to ask them, if you're resting good at night, if you're sleeping. Typically the best advice for a newborn mother would be to sleep when the baby sleeps. So once you've completed that assessment, you would go through there and you would document everything and go ahead and wrap everything up.